There are many different things that could trigger a seizure. I'm going to show some of the things that could possibly cause an epileptic person to seize. First off is flashing lights. Photosensitive seizures are triggered by flashing or flickering lights. Images flash very quickly, and generally this is too quick to trigger a seizure in people with photosensitive epilepsy. However, the field of view is large, and so more of the eye is stimulated. This means that the brain may be affected, and this may trigger a seizure. Next up is medication. Skipping a dose of your epilepsy meds could lead to a seizure. Next is lack of sleep. Seizures are very sensitive to sleep patterns. Some people have their first and only seizures after an all-nighter or after not sleeping well for long periods. Next off is stress. Some people feel a loss of control when they are stressed. This can cause someone to hyperventilate, which can increase abnormal brain activity and cause seizures. Next is drug and alcohol use. Alcohol is a common trigger for seizures, especially in the hangover period, since your brain is very dehydrated. It also disrupts sleep patterns. Alcohol can make epilepsy medications less effective or make the side effects of the medication much worse. Next off is bad eating habits. Low levels of minerals, sodium, calcium, and magnesium can alter the electrical activity of brain cells and cause seizures. Next is television and computer games. Epileptic seizures can sometimes be triggered by certain speeds of flashing or flickering lights and by some geometric patterns. Lastly is the menstruation cycle. The amount of hormones in the body changes throughout a woman's menstrual cycle. The drop in progesterone just before menstruation may trigger seizures in women. The rise in estrogen during ovulation may also trigger seizures.